And welcome back to Health First. Today I'm here with Dr. Mikhail Mirer, who is a pediatric neurologist. Hi, Dr. Mirer, how are you?
Hi, how are you? Good
I'm
morning.
good, thank you. I would like to start off by asking what influenced you to go into the medical field?
The medical field, well, that was a long story, long time ago. I, well, I always liked to work with people and help people.
Mm-hmm.
And I knew that when I was 16. Ironically, for some reason, I wasn't really interested in school until high school, when all of a sudden I developed like passion to help others.
Mm-hmm.
And I wasn't sure if I want to do veterinarian medicine or just medicine. And my parents were the best guidance who suggested to try this route. And I went to medical school. That's pretty much the story.
And you are a pediatric neurologist. Why did you
Yes.
choose this specialty?
Well, many things happen in life that is difficult to explain. My first specialty when I was in medical school, uh, when you get to the point that you need to make a decision, and that's what I teach my residents and students now, right? You need to kind of get an idea. All right, you like medicine, you like helping people, you work with people, and the first portion of that has nothing to do with actually working with people. It's all science. It can feel boring until finally you get to go to the hospital for your clinical rotations, right?
Mm-hmm.
And then you need to make a decision. What type of medicine do you want to do? Is it hands-on medicine when you touch your patients, when you do surgeries, procedures, and like some instrumental skills, right?
Mm-hmm.
Or you want to mostly talk to people. I'm talking about the opposite side of the spectrum. When you talk to people, let's say like psychiatrists, you don't touch, but you talk. And it's two spectrums, right? Then you kind of decide if you want to do a little bit of each. And for you who don't know how the medical education, the highest medical education as a physician goes, you pretty much do not know until you're ready to graduate from medical school and need to pick the residency type. And I know that some doctors actually choose one, don't like it, and switch after a year, all right? So technically, my choice was this. I wanted to do mix of clinical and surgical skills. And my first profession was right after medical school, OBGYN. It's obstetrics and gynecology, right? So you have a little of surgical, well, not a little, a lot of surgical skills. And then you do actually just the clinical exams and everything.
Mm-hmm.
Then, as you probably know, my family came to the United States when I just graduated medical school. I was in my 20s. And I had to repeat all the tests and get my diploma back. Once I've done that, I had to do the same thing, choose the residency. I did not find the spot in OBGYN. And the other option was to do something entirely new that I've never done before. And that's how I ended up in pediatrics. I love this field. It's great. When I talk about pediatrics, I sometimes joke, that pediatrics falls between veterinarian medicine and real medicine. In between, it's pediatrics, right?
Mm-hmm.
We work with the small kids and babies. We commonly talk to owners/parents, right?
Mm-hmm.
And at some point, I felt that general field like pediatrics is not challenging enough for me. I wanted to have something more intellectual that you can, ideally see more complex cases. Like as of today, I see patients who were before seen by one, two, or sometimes three physicians, and they still have a question. They send it to subspecialty. So at this point, when I was already in pediatric residency, I was kind of considering few different fields, which in fact included, let's say, gastroenterology and cardiology and some others. But I felt that neurology gives you probably the widest range of activity that you can choose. And in the future, I didn't know what I want to do because neurologists can practice adult neurology too, pediatric neurology, and I still can practice general pediatrics if I want to. So it gives you like a hub, a huge spectrum of your activities.
Yeah.
That's how I ended up in pediatric neurology.
Mm-hmm. And you work in a hospital setting. So can you tell me a little about your specialty?
Yes, I do work in the hospital and I also work in the office. So when the patient gets admitted to the hospital, I need to go and see patient in the hospital, evaluate, and sometimes treat the patient in the hospital if this cannot be provided at home. On the other like occasions, I would see patient in the office where those patients would be sent for consult from the primary care physicians. As you remember, I mentioned that I see patients who were seen by other physicians and they still have a question, what is that?
Yeah. And can you tell me a little more about how you help people?
Well, sometimes it can vary between ordering very subspecialized treatment, right? That only, let's say, neurologist knows the dosages, the studies that need to be ordered to make the proper and correct diagnosis timely, right? But it's not only that. I always feel that when somebody gets in trouble, just talking to them might help to get through the trying times, because patients do not know. They have multiple questions to ask. Everyone is nervous, specifically when the life of your child is on the table, right? And you need to really discuss that. So it's a variety of different things. Not to mention that I'm at some point I was a chief of the pediatric department in a local hospital in Pennsylvania, and I ran two services, general pediatrics and pediatric neurology. So worst comes to worst, I know how to intubate, how to do the central lines, put IVs and such. So it's a very wide question, rather, how I help. I help with everything I can, from talking to doing many things.
And what do you like most about your specialty?
As I said, it's very challenging, intellectually challenging. You need to really know a lot. It's like almost solving the most difficult puzzle, all right? Sometimes you need to put a story together in order to make a right diagnosis when you need to. It is exceptionally interesting, not to mention that the clinical skills, when you can assess the patient and see the subtlest signs and symptoms that no one else knows what it is, and you notice that and you put them together and you get to the right diagnosis.
One thing that has really hurt the nation is the COVID-19 pandemic. What was it like working during the pandemic?
Oh, listen, that's the long story. I'm sure if I went through the all stages that most physicians went through, started from the fear that all of us had in the beginning, and no one knew what it is. And most of it, you don't know if you catch it, if you're going to make it or not. Then we started learning a lot. But you need to understand, doctors is a special breed of people. At some point, we put our own life on the side. We don't think about this. We think about lives of our patients. It was scary. Then it was very exhausting, just because of the volume, and you need to wear all these PPEs nowadays, which are very unpleasant to wear. You get home with pretty much sores on your face from the mask, and emotionally and physically exhausted. You sleep, you take a shower next day, and you go back. And you do that every day.
And how are you able to help people during this time period?
I did treat children who were sick with COVID. Some of them were really sick, some of them were not. And luckily, most of them successfully made it. All right. I still see patients now in the new hospital that I just recently came to. I saw patients with COVID who had another complications that required neurologists to come in and see, including seizures, encephalitis, and I would just dress myself back to this mask and all this attire and go in the room. It is, look, when you become a physician, you pretty much put yourself in danger if needed. All right?
Yeah. Can you give a few words of advice to my generation?
Just remember this thing. It's very hard to give any advice to any generation. You guys live your own life. But I tell you this, medicine is the specialty forever. It's not going to go anywhere. It's a privilege to treat somebody, all right? It's not given right. You need to earn this privilege that the other people trust you, their lives and health. And it's not about money, that's for sure, all right? But it's about something that you can enjoy doing and have a gratification from what you do, all right? I receive letters from patients from parents of the patients who I took care of, usually like before the Christmas or these big holidays. And I understand that they live their lives because once I helped them. Isn't that big? I think so.
Thank you so much for joining me, and thank you for giving us an insight on pediatric neurology.
And one last advice. If somebody wants to become a doctor, that is not a sprint, it's a marathon. You need to get ready to do that somewhere in high school and be persistent. It's a very competitive field. And it's not just to have this badge of being a doctor. It's actually much more. You need to learn a lot, and it's a persistent work, but it pays back with definitely the security of job and money, and the most of it, the satisfaction from what you do, that your life is meaningful. Not just like bam, 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 bam.
Thank you so much.
Salute.
Have a nice day.